Start with basics, I guess. The difference between Gilchrist Hospice and Gilchrist Kids.
Yeah. So most people know hospice sort of as for maybe older people. Maybe you've had a grandparent or a great-grandparent who's needed hospice service at the end of their life. Maybe they've had a long journey with cancer or maybe Alzheimer's, and their condition has really deteriorated, and it's just really important to families to stay at home, make their loved one comfortable, and to sort of have a peaceful death in a home setting. Pediatric hospice is all of that, but it's a lot more too, which is really cool. It's very isolating to have a sick child, especially a child with a potentially life-limiting condition, because a lot of people don't understand. People don't know what to say. Sometimes they run away because they don't know how to act. So our team can come in, not that we're replacing friends or family, but we're able to say, this is what some other families have done who've been in your situation. We've heard your similar story before, and maybe these are some things that can help. And we have sort of the wraparound services to meet every patient and family where they are with exactly what they need. People are kind of able to pick and choose what part of hospice and what part of the team they really need the most help with. And then we're able to come in and kind of fill that void.
Is this relatively new, having hospice for kids?
So I think it's not new. Unfortunately, there have always been children who are dying. It's something that nobody likes to think about. I think what is new is in 2010, when the Affordable Care Act was passed, there's a provision in there for concurrent care for children, which says that children who receive medical assistance, who are under 21 years old, can receive hospice care alongside curative, life-prolonging treatment. So that concept is new, and I think that's why we've seen an uptick in the number of patients who are using our service, because a lot of times before, parents sort of had to choose. So maybe it was that we've decided that we want hospice, we're going to stay home, we're not going to go back to the hospital, we're not going to pursue new treatments or new medications. And now they don't have to make that choice.
That's amazing.
Yeah.
Because
really
I think
cool.
anyone who's lived long enough, who maybe had a parent or some relative, they had to make a choice as an adult about choosing hospice or not. So this way it's almost like everyone has hope for a very long time, and as long as they can use it for.
You seem to be keen on home care. Is there an inpatient part of it as well? Because that's what we think of when we think of adult hospice.
Yeah.
Somewhere you go to.
And that's a great point. So most people think of hospice as kind of a place, especially here in the Baltimore area, because the Gilchrist Center at Towson is so well known. People kind of think that the Gilchrist Center Towson is hospice and that hospice is a place, whereas really hospice is a concept or a philosophy. So the majority of hospice patients, not just here in Baltimore, but throughout the country, are cared for at home. However, there are inpatient centers like the Gilchrist Center Towson and like our pediatric inpatient unit that are for special circumstances. So we're really excited because Gilchrist Kids just within the past year opened our pediatric inpatient unit. It's at Gilchrist Center Baltimore, which is downtown, not too far from University of Maryland. We have 4 beds that are just for infants, children, and young adults. So as you can imagine, trying to have a child cared for at an adult inpatient hospice facility, it feels a little weird because most of the patients there are older, and the nurses are really used to caring for older adults with different conditions. So we have specialty pediatric trained nurses who are here at this unit. It's a beautiful, bright, open space. We have a giant playroom. Everybody's super, super focused on making it a good experience. Children are naturally resilient. I think we all know that. Their tendency is usually to fight, and their bodies can do things that can prove us wrong all the time.
Gilchrist Kids, thank you for talking to us, and thank you for what you do.
Thank you so much. I appreciate
and thanks
your
for
time.
enlightening us.
Absolutely. Yeah, thank you.
You.